Good afternoon. I'm Dr. Bobby Banks with Pillar Consulting, and welcome to Black Wall Street's VibeCheck. This program is developed by Duke Health and Complex Creative to spotlight conversations around the pandemic. We've been in this booger for over 16, maybe 18 months. Let's talk about the vaccine and everything in between. So in these conversations, we brought a couple folks who know what they're doing, physician, epidemiologist, but most importantly, we have some young folks here because we know that you have been put in class, out of class, around the class. Your life looks very, very different right now. So we want to hear you and hear your truth. So I'm going to give you an opportunity to introduce yourselves and tell us who you are.
Good afternoon. My name is Kyndall Ray, and I'm a sophomore biomedical science student at North Carolina Central University. I'm a member of a couple of organizations such as the University Honors Program, 1111 Durham, which is a community service-based organization, and the Black College Businesswomen Association. And yeah, I'm just ready to get out of this pandemic.
Afternoon, I'm Alvin Mutongi. I'm a junior at NC State, majoring in civil engineering. I'm the president of NC State's NPHC chapter. I'm a member of Alpha Phi Alpha Fraternity Incorporated. I'm also the project lead for the Guatemala Water Systems team of Engineers Without Borders at NC State. So yeah.
All right. So those are our Gen Z people, and I think we have some more seasoned individuals on this side of the panel. If you please introduce yourself and let us know who you are.
Sure, yeah, seasoned indeed, absolutely.
Yes, we'll call us ourselves seasoned.
That's a good way
on
to
the
put
left
that.
side.
I like that, yeah. My name is Julius Wilder. I'm a physician at Duke University. I'm an assistant professor of medicine in the division of gastroenterology. He's not wearing a helmet. Someone please get that guy a helmet. I do gastroenterology and hepatology at Duke. I also serve as the chair of the Department of Medicine's Diversity, Equity, Inclusion, and Anti-Racism Committee, and I serve as co-director for the Community Engaged Research Initiative. And so, happy to be here and talk about, our work on trying to get us out of this madness.
All right. Thank you, all three of you, for being here today. So clearly, each of you are very active outside of a pandemic. You talked about several organizations you're involved with, and you wear several hats as a physician at Duke. How are you feeling? This is called the VibeCheck. Tell us, how are things going? Now, I'm not doing you. Don't send me a copay. I'm not a therapist. But tell us, how are things going? Life clearly looks very different for you right now, or does it? Tell us, how is life?
Honestly, it's a little overwhelming. This is not what I expected when I, applied to college and came to college. I was expecting more of like in the classroom, having fun out on the yard, but it's giving very much in the dorm room with the doors closed. And it's just not what I expected at all, especially like when it comes to like opportunities and learning about other programs. There's so many things that I've missed or haven't been able to do or apply for, which is just weird to me.
Thank you for sharing that. Alvin?
Yeah, so my experience is a little different, being as like I had about a semester and a half of a normal college experience, and then I went away for like a year and a half, 2 years, and now coming back, being in positions of leadership, not really knowing exactly what I'm doing, but learning as I go is definitely something that I've been feeling.
Thank you. I don't know if we're supposed to check in with the seasoned saints on the left side, but check in. How are you doing?
I'm tired and I'm frustrated, to be quite honest with you. This has been going on for a long time, and I feel like there are a number of factors that have helped perpetuate this to be worse for us than it is. And, seeing in the hospital what's happening right now and the unnecessary deaths that are occurring right now, and knowing where we are headed in terms of ongoing issues with COVID, and now RSV in our children, and now flu coming up. There are a number of things we need to be thinking about. And it's tiring, to be honest with you. A lot of my colleagues are very depressed, and they're tired and frustrated. And so that's where a lot of us in medicine are right now. We were hoping that we would not still be, piling patients up in the parking lot in front of Duke ED, 18 months into this.
Thank you guys for being transparent with that. I think so often in life, people tell you to keep pushing and keep going, right? How you doing? Oh, I'm good. No, I'm not. I have a couple things I might be going through right now. So thank you for sharing that. Curious to know from the Gen Z folks, and I'm so glad we have a physician here. So it does not matter if what you feel that you're saying is spot on or a little bit off. What are young people talking about with COVID? Like, what do they know or what don't they know? And I'm telling you, just give it to us plain. We have somebody here to tell us whether it's true or not. But what are people talking about, or what are they not talking about?
Honestly, as time has passed, I feel like they've gotten a little bit better because at first, most people in my generation, it's just we look at social media. People don't really like watch the news. So on social media, it was a lot of, oh, if you get the vaccine, like you're gonna die, you're gonna be infertile, or like COVID wasn't that serious. You didn't have to wear a mask. So people weren't really taking it seriously, especially at first when it was just 2 weeks out of school. Everybody was like, okay, it's a little flu, we'll be back in business. But as time passed and like people started to die and like things started getting more serious, I feel like they've done a lot better. Like especially like at school, everybody wears their mask, everybody follows the rules because at this point everybody's ready for this to be over with. So they're trying to follow all the rules the best they can so we can eventually get back to some state of normalcy.
Thank you for sharing that. Alvin, do you have anything to add?
Yeah, no, just kind of like echoing that, how at first it was kind of like, oh, it's not that serious, and then plus you're younger, and so you have like a lower risk, not a risk of zero, but a lower risk of having like a severe reaction to COVID. And so like as time has gone on, people have better been able to understand that you're not just doing it to protect yourself, but to protect others. I know my school is like 75% vaccinated at this point, like 75% fully vaccinated, like both shots through a waiting period and everything. And so it's definitely getting better.
I can tell you're a data person. I'm trained in epidemiology and biostatistics, so we crunch numbers. And the fact that you know that you're at 75% vaccination rates, that's quite all right. I don't think I would have known that at your age, so that's cool. So you've heard that the vaccine does this or does that or might make you infertile. What are some other things that you have heard that I'm so glad we have a physician here that might say, let me tell you a little bit about that. So you've heard infertility. What other things have you heard about COVID or the vaccine?
I don't think it's more of like a specific, it would cause something, but a lot of people were just skeptical about it, seeing as like how the pandemic is fairly new and the vaccine came out like months or so after the pandemic, and other vaccines or shots had taken like years to develop. People were just thinking like, oh, the government has something to do with it, or they didn't know exactly like what was going into the vaccine or how was it safe since it was made this fast. So I don't think it's more of like them confused like what it would cause. It's really just being skeptical of like the government and stuff like that.
Alvin's nodding. Okay. Copy, paste, cosign. All right. So swing it back over to the left side. So I think that Gen Z and some of the seasoned folks have heard some of those same things. Can you tell us about the vaccine being, quote, new?
Sure.
Just popping up.
Yeah. I mean, COVID is new, and we did develop the vaccine quicker than we normally do. We were able to do that because of a special technology that, quite frankly, has been around for a long time, and has been used for vaccination in the past. We leveraged that new technology to develop the vaccines for COVID. Not all the vaccines for COVID-19, but some of the vaccinations that exist for COVID-19. And that's an mRNA technology that allows us to very quickly sequence a vaccine to the antibody of the virus. It's funny because you're correct. The flu vaccine has been around way longer, obviously, than the COVID-19 vaccination. But if you look at the actual amount of individuals in which the vaccine was tested on in both clinical trials and in official clinical trials, as well as real-world data, we probably have as much or more data on the COVID-19 vaccination. And then what people don't realize is that the flu vaccine is new every single year. So when you get your flu shot every year, it's not the same flu shot from last year because viruses continue to replicate and change, which is how we got the Delta variant in COVID. And so the flu vaccine that everyone got last year was a new vaccine that did not have a massive clinical trial before it was used. I think you touched on something really important, though, the idea of social media and unreliable sources driving a lot of that misinformation, because it does not make you infertile. We have millions and millions of women who at various stages of pregnancy have been vaccinated and there have been no concerns. We also know that, you make a great point, Alvin, there's been a lot of conversations about younger people being okay, but what we're seeing now is that a lot of the people who are very, very sick in the hospital are younger individuals. As we learn more about the variants that are a little bit more severe, like the Delta variant, and more about some of the risk factors that can be a problem. And so there are a lot of these sort of things that are out there that we're learning more about right now. But yeah, I mean, it really is a very, very safe vaccine. We have a tremendous amount of information on it.
Tell us some of the other things that we may not be talking about, how I shared earlier. Thank you, sorry so much for sharing that new is not new in the sense that many people think. It is an existing technology applied to a new virus. Is coronavirus, because I've seen so many people turn the Lysol bottle around. You may have seen that on social media, like, how is this a new virus and it's been on the Lysol bottle and I've had Lysol for 30 years. Is coronavirus new?
Not at all.
Okay.
It has been around for a long time.
Okay.
But this is a unique variant that has popped up, just like we saw this Delta variant everyone's learning about right now that's driven a lot of what we're seeing. But yeah, not new.
I think we all need to understand what this new means when things pop up. So another thing we might not be talking about, clearly you showed up today. You're glowing, your eyes look all perky. How are you making sure you are well in the midst of so much change going on in the world? We call it coping, right? People say self-care and go, dance in the rose petals or whatever people do. I bang on drums, that's how I roll. How do you make sure that you're okay every day? Do you check in every day? Do you have friends you talk to? Like, what does wellness look like for young people in the midst of so much change?
So I go to a PWI, and so I spend a lot of time in the African American Cultural Center, whether that's just like time I use to do my work, or hanging out with friends, or going to like programs that they have on Friday. But that's basically how I keep myself going and like take care of myself, because they have counselors in there if you need to talk to somebody. So like African American Cultural Center, Multicultural Student Affairs at NC State, those are places that I spend some time to kind of like recharge.
How did you know those resources were available? I mean, the center clearly has been a center, but how did you know counselors were available or some of those other resources?
Yeah, I mean, my freshman year, like one of my mentors had like showed me around campus and like took me to those spaces. And so like getting that formal introduction was basically how I knew they existed.
Okay. Thank you. How about you?
For me personally, I'm really close with my family, and I'm lucky that my school is not that far from my house. So if I'm ever feeling a little down or I just need an escape, I'll just take that little hour and 30, head home, talk to my family, kind of reconnect, get like a change of scenery, change of food, different things like that. And I also am really, really big on food. So I might find a new food truck or find a new restaurant, text one of my friends, hey girl, you want to come eat with me? Boom, get cute. And dressing cute really makes me feel better too. So a nice outfit, go out to eat, take some pictures, kind of just decompress from all the negativity, and then come back and jump right into it and do it all over again.
Thank you for sharing that. You guys, or one of you talked about the things that you saw happening on social media, and some could be true, some may not be true. How do you know the right places to go to get good information? Is it trusted people? Is it a place?
For me personally, my dad is a doctor, so like when I see stuff like that, usually like of course you check like the trusted sources like the World Health Organization, those type of sources, but my dad is like easily accessible to me, so I'll just FaceTime him or text him and be like, Dad, somebody posted yada yada yada, is this true? And he'll be like, no, this is made up, or a certain part of it may be true, but somebody took it and ran with it to make it more complicated or seem worse than what it really is. So for me, yeah, I just talk to my dad about it.
Yeah, and so like I think social media can be good if you use proper like discernment and you use reliable sources, like professors at the university that like study COVID and study like epidemiology day in and day out. They also have Twitters. They can link to like actual reliable like websites with like data and all the resources you need to really understand what's going on in the pandemic. And so curating your social media that way can be beneficial, as opposed to just like spreading whatever you see just because somebody said it. So really just taking into account who's saying what and where the information is coming from.
Very smart, very, very smart. Who is saying what is very important. Curious to know, so this event is put on by Black Wall Street. This area has very rich history of Black folks thriving in the midst of so much. And we know that distrust is very real in Black and brown communities because of historical and very real contemporary inequities, you name it, research, medicine that people continue to see pop up. We see even with the COVID-19 pandemic that new cases, death, and hospitalizations look very different for Black and brown people. The data shows us that. So tell us if young people are talking about the distrust that exists, or isn't it an issue for Black and brown people? Like, are they talking about the Tuskegee, or here in North Carolina, we know that there were women who had forced sterilizations, or their uterus were removed. So are young people talking about that? And is it, in what context, how are they talking about this? Because it's an elephant in the room in many ways.
I've definitely heard that mentioned, especially when you say like the Tuskegee. I've heard that, but a lot of times I don't know like if that's really what they're thinking, or like they saw somebody on Twitter post that and they took it and ran with it. So like, of course, like I'm definitely not discounting that happened, but I know me personally, like when I heard about the vaccine, like, I was just like, oh, it's another vaccine we have to get. Like we have to be vaccinated for certain things to go to school anyway. So I wasn't really trying to look for different sources to say, oh, I shouldn't get this. But a lot of people, like, they just didn't know anything to say about it, so they ran to the internet, and like that was the first thing that were popping up, like about the different things in our community. So I do think like that can be scary, especially seeing like how it's happened in history, and history repeats itself. So it could they possibly could think it could be happening again, but I haven't really heard too much about it recently, especially like since they started having more vaccine clinics on school campuses, and making sure they bring in more like physicians and the experts to like educate people about it. I feel like after everybody's like learned more about it, like what's going into it, how it's made, they're being more trustworthy of the vaccine and of the science behind it, instead of just focusing on conspiracies.
Yeah, basically echoing everything that was already said. One thing about this Tuskegee experiment that I think is different from COVID, and somebody explained it to me like this: in the Tuskegee experiment, once like penicillin had become like the preferred method of treatment, they still withheld that treatment. But when it comes to the vaccine, they're not withholding treatment. They're trying to get people to take the vaccine, and so yeah, it's a little different in kind of methodology. So.
All right. So we know that you are a civil engineer major, you are in the biomedical sciences, and we have a physician here. Curious to know, are students talking about, so they're talking about the vaccine and what it can or cannot do, but are they talking about what COVID could do to the body? Like what, I'll ask you in a moment, but what you would see in a hospital, what COVID does to the body if you are not engaging in preventive behaviors, which include washing your hands, wearing your mask, social distancing, weighing the risks and benefits for vaccination. Like, are young people talking about Rona and what Rona might do to their bodies?
I know one of the biggest concerns about like coronavirus is like the permanent loss of like taste and smell, or even like semi-permanent loss of taste and smell. That's a big concern. I know it's a big concern for me. It's a big concern for some of my friends. So that's definitely one of the things we talk about.
People like they have been talking about like how like it affects them, or like makes their body like feel weak and stuff, because we still are at college. So at the end of the day, like, yeah, people do want to go party, especially like it might not be safe, but people do that and they might get COVID, and they go to the little quarantine dorms and things of that nature. And then they come back and they tell their friends like, hey, yeah, I know like we want to party and stuff, but those 14 days I was in the dorm, like I was not feeling good at all. So kind of, it's bad that they have to get it to know how serious it is. But once the people do get it, and like they go back and tell their friends, like it's trickling through the school, like, hey, like don't go out, just wear your mask, because it's real and it's painful.
There are adults like that too, ma'am. They unfortunately, they have to experience it to actually get it. But I'm glad that you said that. Young people too. So I think we're all human at the end of the day, and some people's decision making just look very, very different. And unfortunately, 14 days in a quarantine dorm got them there. So what's so interesting about the physician we have on the panel today is that he studies some of the organs that I think most people don't think about when they think about COVID. So you just talked about losing taste or smell. You talked about not being able to go out and be social, and one of the first things you talked about were people dying, right? We see the numbers with people dying. Can you tell us how COVID affects the body? Because I think people, they have appropriately said what COVID can do. What else can it do that people may not be aware of?
Sure. So I mean, obviously, it is a virus that can be transmitted through the air, but it gets into your body because of a receptor that it binds to called ACE, and that same receptor that is found in your nasal passage airways is also found in your heart. It's also found in your kidneys. It's also found in your GI tract. It's also found in your liver. And so what we find is that besides the horrific pulmonary infection that people endure that can result in a severe pneumonia, your lungs filling up with blood, and multi-organ failure just from the impact of COVID directly on your lungs, it can also have a significant impact in terms of your heart. We've seen both in adults and often actually in very young people a horrible what we kind of COVID myocarditis, or an inflammatory process in the heart as a result of COVID attacking that receptor in the heart. We've also seen it have a similar impact in terms of people having really bad kidney function. And then finally, I'm a gastroenterologist and a liver doctor, or GI and a liver doctor, and we've seen COVID cause a number of symptoms and issues in the GI tract, as well as really bad inflammation of the liver as well. And so it's a unique virus in that it does such a good job of being very easily transmitted, but the receptor in your body that it binds to do its damage is found in so many places. It can also cause clots because of the impact it has just within the actual vessels in your body. And so it really is an exquisite predator for us. And so I think people think about the pulmonary stuff, but the impact goes beyond that. And very quickly, Alvin, you touched on something that people we're actually beginning to study more now, which is long COVID. Because you think about the fact that it has this sort of impact on your sort of neurological symptom, right, taste and smell, but affecting all those organs, there's this sort of new condition called long COVID that we're beginning to study to understand long-term what happens to you, particularly in light of the fact that we know it has such a dramatic impact on so many organs in your body.
Do you think most young people know that?
Absolutely not.
Say more about that. Tell us. And that's why one of the questions I asked you earlier is like, where do you go to get your information? You talked about the World Health Organization. Everybody doesn't know that. So, like, why? I was laughing at your face because you were like, absolutely not. What do you feel they know? And just tell us, was it just lungs? Was it just loss of your face is making me laugh.
Really, like, all that we really like hear about, especially like that's posted, is just like respiratory, like can't breathe, loss of like shortness of breath, can't taste and smell, and like that you may feel like weak or fatigued, like similar to the flu. But as far as like heart and all of that, I did not know that.
Yeah, I feel like most people just think of it like as something that you go through for however long you have it. And then, once you get it, you have like antibodies in your blood or whatever, and you're good. But I don't think people are thinking about the long-term effects.
So that device that everyone's talking about, ECMO, extracorporeal mechanical oxygenation, it hurts your organs so bad that there's a machine that they connect you to where they have these wires connected to the big veins and arteries in your body. All the blood leaves your body, goes through a machine that oxygenates and does the things for your organs before it gets back into your body. And we've actually run out of those machines in many parts of the country because of so many people being sick with ECMO. Being sick with COVID. And so I think it's really scary when people think about, just the impact it really does have on the body.
I feel like I just got my biology 101 lesson. So the receptors that the virus enters your bodies with is also in your GI tract, your heart, your kidneys, your liver. And so the virus can attack all of those organs. I see a lot of people saying, as you said, I already got the antibodies. The survival rate is 85, 95%. I'm good. What does survival rate mean to young people? And then I would love for you to explain it. Because folks my age are like, oh, it's 95%. I'm okay. Oh, are you really? Or have you talked about? I don't know if you've talked about survival.
Yeah, honestly, I haven't really heard anybody like talk about the survival rate. Honestly, it's just so like either I do hear people say like I got it, I'm good, but like as far as like the rate specifically, I don't think anybody really like thinks about that, honestly.
Yeah, again, I think it's more so people aren't really worried about dying from COVID. And so they're like, oh, I'm not going to die, so I'll be all right, but not really taking into account the fact that you might be very different after you get the disease, and it might like permanently affect your life. And so, yeah, they don't really process what survival rate could really mean for your life.
Tell us what that means, right? You got COVID. You might have been hospitalized. You might have been laid out in your quarantine dorm. You might have been laid out in your house, worn out, exhausted because this virus is attacking your body. But then you all right. Like, you get back. But are you all right? What does survival really look like? Because I've heard from some physicians that people have had to get limbs amputated because the clots were so bad, but they survived. So tell us what survival really means, or what it looks like in the hospital.
Yeah, and that's a really important point that you raised, because, you know, when we're talking about survival, we're talking about mortality, right? Do you live or not? Do you live or die? But there's also morbidity. And what morbidity is referring to is, you know, how does the virus affect your health at this point moving forward? What are some of the side effects, so to speak, long-term impact of having the virus? And this gets back to the long COVID, which again has a number of sort of debilitating symptoms over time in people: headaches, severe fatigue, issues with sense of smell and taste, and of course potentially long-term damage to multiple organs, as we discussed already, including due to clots, as you alluded to, this issue with amputation. But the other thing about it is that even if COVID does not kill you, the longer we allow COVID to be around and replicate in us, the more opportunity we give COVID to have another variant come up. So we have the Delta variant because of the approach they took in India, where they're basically survival of the fittest. That's where that's how the Delta variant was created, because it was in a population that was not vaccinated, that did not implement public health, things to help, reduce the transmission of the virus. And so that's how you had development of this Delta variant. And so if we are not able to sort of suppress us, me giving it to you, you giving it to her, her giving it to him, that replication of the virus in all of our bodies is how it gets that genetic change to create new variants. If we can't control that replication, then that's how you get another variant. And our concern, of course, is this variant out there that could exist that would not be susceptible to our vaccinations. And then we're back to square one. And so that's the scariest thing we have in medicine right now, is this idea of that, because I think you're right. A lot of people think, oh, I'm young, I'm healthy, I'll be okay, I don't have the risk factors. But you allowing that virus to be in you and replicate and perpetuate is how it becomes stronger and eventually can mutate into something that our vaccines don't work, or the antibody that we've created doesn't work, or ECMO doesn't work, and then we're really in trouble.
Thank you for explaining that. If it's helpful for young people to know that the longer the virus is out here, it's going to keep changing to be efficient, to do what it needs to do. And so I'm glad you said that the folks who, you said you're already masking up when you go out, but even if they've had COVID, that they're still masking, because viruses are going to virus. All right, we've talked about all the science on the Good Green Planet. We talked about the biology, the virus, and all of this. There are a lot of things going on socially in the United States of America. So what we know is last spring through last summer, much of the world finally saw racism. They finally understood that everybody ain't treated the same way. Everybody does not have access to the same opportunities, and that's from systems, housing, education, legal, you name it, to them interacting with the health establishment, right? And so a lot of people's awareness was kind of piqued with George Floyd, seeing a black man's face on the ground for over 9 minutes. That in the middle of a global pandemic. What did that feel like for you as a young person who were probably already quarantined at that point or isolated, to see that happening outside of your window? Because we don't always talk about the social things going on, but they're going on.
It was honestly really sad, because of course, growing up, I was learning about Black history, doing projects, seeing stuff that's happened in the civil rights era. And it's just really sad to see. It's so many years later and the same things are happening, just with a little modernized twist on it. So it's really disheartening, especially knowing that we were in a pandemic. Everybody's supposed to be quarantined, being safe, just trying to protect themselves and people they care about, but they're out here killing people. It's just what are you really trying to do? Like, are you trying to save people or jeopardize them even more? So it just was really disheartening and kind of depressing to see, especially with social media being as big as it is now. Like, if it's different. Like, okay, it's in the newspapers, but not every time I log into my phone or change to a different app, it's a video of a man being murdered. It just makes me feel not good.
Yeah, kind of the same thing. It was very disheartening, very like upsetting, to constantly see these images, because it wasn't only George Floyd, it was like Ahmaud Arbery with Breonna Taylor, and so constantly like being exposed to that was very upsetting, very like traumatizing. But at the same time, like seeing the response to it, I was like cautiously optimistic, I guess, because we've seen people like respond and like say Black Lives Matter, but don't actually do any work to like ensure that Black people are protected and taken care of. And so kind of like seeing all the statements, I was like, okay, like we're gonna see where y'all are at in like a year or 2 years from now, and see if y'all really are still keeping the same energy. And in my experience, that hasn't been the case.
And so thinking about this, feeling upset, feeling depressed, being cautiously optimistic, because sometimes just folks throw out a statement and they go back to their comfy neighborhoods. Did that change the way that you view the world, particularly as we're in the midst of a pandemic that's wiping out Black and brown people? For you see an image of what you said, you're supposed to keep people safe. Did that change your view of the world, or had you already had this view and that is why you were cautiously optimistic?
I feel like I kind of already had this view. Like, I haven't experienced like racism or anything personally, but like hearing stories and seeing on social media, because even before George Floyd, there was a whole bunch of other police brutality incidents and stuff. So it kind of already was very like lenient, but just seeing it like broadcasted like that for everybody to see, that just made it even more like, yeah, nope, this is my little box and I'm gonna stay in it. It just makes it seem a little bit way more real. Like, it was already real, everything was happening, but just to have to see it like that everywhere you go, you can't escape it. That's just very scary.
What is that little box? Is it safety? Is it peace? Or I don't want to put you on the spot, but you said stay in my little box.
It's just like my sanity personally. Like, I know, like, yeah, me staying to myself, like, at the end of the day, if somebody's gonna kill me, they're gonna kill me. But it just keeps me sane, like, and helps me like stay refreshed and stay me, especially like with everything that's going on. Just think about the things I like. Okay, this makes Kyndall happy. This is what Kyndall's gonna do, instead of thinking about, wow, if I go outside, somebody might like kill me, or somebody might kill my dad, like something like that. It's just thinking about more positive things and better times.
All right, I want to hear from you. You have a very different well, we're all young at heart, but you are, let's be frank, you're a Black man practicing medicine, trying to save lives of people who are being hospitalized, possibly dying from COVID, and you see George Floyd, Breonna Taylor, social injustices continue to play out as you are trying to save lives. What does that mean for you, and did it change your view on the world and how you navigate your career?
Yeah, that's a really important question. I think particularly relevant in the setting of a COVID discussion, because as you alluded to, COVID has had a disproportionate impact on communities of color, and that is largely a result of structural racism, right? The same mechanism that contributes to Breonna Taylor and George Floyd and the long list of people who have been unfairly and unjustly killed by police. But the same way that we are in a place where police feel justified to behave that way because of a perceived threat simply because of my Blackness, that same mechanism, that same structural racism that drives that is why we see so much more heart disease killing people of color, and why we see so much kidney disease and so much liver failure, right? These same mechanisms that have been around for generations that impact where we live, how we live, what access to care we have, what type of jobs do we have, what kind of educational opportunities we have. All of that sort of contributes to this milieu that leads, unfortunately, to outcomes like George Floyd. And so as a physician who has seen that over and over again, repeated in my patients and in the population and in the community that I serve, it was another example. The difference is that you actually saw a murder happen right in front of you. But I see structural racism commit murder in our community every day in the hospital. And so I think, moving forward, my hope is that, again, alluding to this idea of being sort of, cautiously optimistic, how can we build from this to identify those mechanisms better and begin to create interventions to address them? And we'll see where we go from there, I suppose.
Thank you for sharing that. So we're clearly winding down on time, but what I sense on this panel is optimism. There is a lot going on in the world socially that many of us were already aware of because we walk in and live it every day. But there are some things that you highlighted that sounded like glimmers of hope to me. You talked about your campus having a 75% vaccination rate. You still show up at work and do your stuff every day, and you still go and get your studies, and you dress up and get cute when you feel like it. I'm there for that. Wore my heels today. There's so much heavy weight with the media every time we wake up. I remember seeing a headline last week that said we have officially surpassed the death toll compared to the Spanish flu of 1918. What? With all the information and the technology that we have, still something invisible out there is keeping people from getting or engaging the preventive behaviors that they need to, washing hands, wearing their mask, social distancing, or going through the decision-making process to get a vaccine that the data has shown, hands down, is doing way better than faring with COVID, without question. So what are your thoughts about maintaining a glimmer of hope? Because everyone here, I think, have said, I'm tired. I'm ready for this pandemic to be over. What is the glimmer of hope for you? Because you wake up every morning and the news may not be great, but a glimmer of hope is 75% of the people on your campus are vaccinated. We know that more Black and brown folks are getting vaccinations that are saving lives. Data shows that without question. What gives you a glimmer of hope daily, weekly, monthly, in the midst of a global pandemic that has highlighted inequities in housing, education, healthcare, police brutality, all these things? What gives you hope? I ask very long questions. I apologize.
Really just thinking about like the future in general and what it can hold, like seeing myself graduate from college, getting accepted into med school, like seeing my little sister graduate, just different like positive things, like buying my first house eventually, just positive milestones in my life that I know one day I want to reach, just looking towards those things and how I'm striving to get there instead of focusing on the little downfalls now, just kind of helps me keep pushing forward.
All right, Dr. Ray.
I think one of the things that like kind of gives me hope and keeps me going in times like this is definitely thinking about like all the younger people that are behind me, that like that I do a lot of the stuff that I do for. So whether it be like underclassmen at my university that I got to be in leadership positions for, or my younger brother who's about to graduate high school and go to college, and the stuff that I do to make sure he can like accomplish his goals, or whether it be like my really younger cousins that can't quite get vaccinated yet, that we have to make sure, we're washing our hands, we're taking all these preventative measures to prevent them from getting the disease. Just kind of like stuff like that is what gives me hope and like keeps me going. So yeah.
All right, Gen Z. All right, seasoned saints on the left side. What gives you hope or optimism in the midst of just so much that we continue to see and hear every day?
Yeah, that's actually a really important question, I think, that we probably need to ask ourselves more now. And I mean, I would say the first thing is these two Gen Z folks sitting to my right, seeing people like you and knowing that there are, folks like you that are coming up to be future physicians, future leaders that have your insight around these issues. That gives me a lot of hope. I would also say, behind us, the community. We broadly as a country are very resilient, and we as the Black community, in many ways, we've had to be, but we're also very, very resilient. And I anticipate that same pursuit of our freedom and our right to live and be healthy and happy, and the resiliency associated with that will continue and persist as well. So that gives me a lot of hope as well. And I see that reflected today. You look out here, and I've seen that in the Durham community and some of the work that I've done as well. So,
in other words, we're gonna be all right. All right. Any final words that you want to share? We'll let the Gen Z. I'm not gonna insert all my stuff. Any final words that you want to share? This is a platform for us to hear from you. As I said at the beginning of this panel, like, particularly what we've seen on the news is, the kids are back in school, they're back at home, they're doing hybrid, they're doing this. Is there anything else in terms of giving your voice in the midst of a pandemic that we all are hopeful, well, we all know will be ending very soon? Any final words you want to share before you drop the mic?
I would definitely say, just keep going. Things definitely seem uncertain right now, but eventually we'll get back to some point of normalcy or a new normal, and just find something that keeps you happy and keeps you sane through all of this, and you'll get through it.
I wouldn't be a good alpha if I didn't mention voting. I believe a voteless people is a hopeless people. November is coming up, and even though this isn't like a midterm year or a presidential election year, there are always elections going on. There are always elections in your local community. So tap in with that, find out who's going up for election and whose local leadership you can change. Because in many points in your life, your local leadership is the most influential. And so get out there, make sure you register to vote, register your neighbor to vote, and make sure you go out there and educate yourself on who's running for office.
The future looks very bright. Thank you so much for joining us for this panel. And thank you to Black Wall Street, Complex Creative, and Duke Health for the opportunity to hear the voices of our young people, medical professionals out here fighting on the front lines, and wish you well for the rest of 2021. And I think everyone here said we're going to be all right.